So December 15, 2020, we now have 10,984 cases. We surpassed 10,000 a week ago, and we almost hit 11,000 today. So that's how fast they're coming, 1,000 a week, basically. Reported deaths, we're up to 153. 3,870 of our cases are active. Case fatality rate, 1.4%. As we have more cases, of course, we have more and more close contacts. So the monitoring is related to close contacts of those cases. In our health systems, we have a total of 157 confirmed and suspect cases in either Sparrow or McLaren. 154 of those are actually confirmed to pediatric. 133 of those are on the hospital floor, 21 in ICU, 25 ventilated, and 45 emergency department visits on the previous calendar day, which would be the 13th. So our hospitalization graph from the beginning of the pandemic to now does show that, we hit this peak, I would say middle to end of November. It's kind of hard to say whether we're increasing or not, but everything in here, obviously the difference between 140 patients, COVID patients in the hospital and 160 is significant. But that's kind of where we're hovering right now. We aren't seeing, obviously, this steep climb up any longer. When we look at the different data related to COVID in hospitalizations, since the 4th of October, we do see this spike coming up. It starts mid to end of October and again climbs up, kind of levels out here. The green bar is your ICUs. So you do see some instances of, an increase in people in the ICU. The red line down here is the number of people ventilated. That definitely is on a trend upwards right now. You can see that is just gradually heading upwards. And then the ED visits, emergency department visits, do tend to bounce around quite a lot. So, got a day here that's much lower and then a couple of days that are higher. So we do see quite a bit of bouncing with that. We currently have 35.2% of our cases active, 63.4% are recovered, 1.4% deceased. And then this is our cumulative curve. This is not a curve we expect to bell curve up and then come back down. What we're looking for is this to flatten out. So we want it to quit heading up and we want it to just eventually curve down and flatten out. So when we look at our daily incidence curve, you can see that we did have days where we had well over 200 cases in the last few weeks. It looks like a little over 250 was the top. And again, those bounce around a little bit, but we can, smooth those out in a 7-day average. This was the MSU related outbreak we saw in September. This was an outbreak in basically late June, early July. Actually, there were a couple of them at the time. Percent positivity has also basically risen really above 10%. You see a day here or there where we're below, but we are above 10% in our positivity, have been really hovering near 10% ever since really early November and continue to stay at that near 10% mark or even above 10%. We have approached close to 15% at times, which is a very high positivity rate. When you put those two things into a rolling average, you can see that our incidence curve did start to come down, a little bit of a tick back up, and now seems to be coming down. Again, when we do 7-day rolling averages, keep in mind any cases now can affect any of the prior 7 days in terms of what that curve looks like. So we do sometimes see some changes in which direction things look like they're heading. We did get on a 7-day rolling average up to about 12% positivity. We're sitting there right now at about 10 point something, 11% in terms of our 7-day average in terms of percent positive. Like I said, any of this that is in this 10% range is not good. Honestly, any of this in this 7% range is exceeding some of the standards we have for, being fairly low level. And we really want to get that number back down close to this 5% range or below. When we look at zip codes, 48823 still has about twice the number of cases at 48911. And then we go to 48910, 48912, et cetera, all the way down to, we still do have a handful of zip codes that have basically 1 through 10 cases. So you can see those in there. So we kind of are all over the place with regard to, where cases are in our zip codes. But you do see a lot in 48823, the Lansing zip codes, 48854, which I believe is the Meridian Township, because 48864 is Mason, correct? Somebody correct me if I'm wrong. But anyway, when we look at that by a rate map, East Lansing is still the highest, even though they have the highest population. That could change it, followed by Lansing and Mason. Lansing 48911, I should say, in Mason. Then we have Holt, Hazlitt, Williamston, Leslie, Onondaga at our next level, and then Lansing out towards the airport, and Okemos, Dansville, Weberville, Stockbridge at the next level. Our heat map still looks like this, as we have literally double the number of cases in 48823 than basically 48911, which is this zip code down here. But you do see a lot of, activity going on in pockets all over the place. You just don't see this intensity that we saw outside of campus right there. So this gets you to Lansing. Again, we know these are apartment complexes, even up here, an apartment complex, because that kind of gives us that pattern. When we look at cases by sex, 51% male, 49% female. When we look at cases by age range, we have 32% in our 20 to 29 age group, still our most prevalent in terms of age group. Our 10 to 19 age group really is dropping down to where it's along the same line as the 30 to 39, 40 to 49, 50 to 59, still a little bit higher, but not extremely so. When we look at cases by race, 60% of our cases are Caucasian, 12% are African-American or Black, 15% are other. I'm just going to explain it one more time because I think it's important to explain. We don't have that many Pacific Islanders, Native Americans, and those sorts of things, which is typically other when we look at races across the category. What we're really dealing with is that a death certificate allows Hispanic to be a race. The sorts of demographics and studies and things that we do, look for a race is Black or African-American, Caucasian, Asian, other. And so we do have a number of Hispanic or Latino people in our community that just simply don't identify as being Black or African-American, nor do they identify as being Caucasian. And rather than putting them as unknown, we've been putting them as other. So that's why you see that number in the other. A lot of that has to do with Latinos who do not identify as either Black or Caucasian. When we look at the rate between Caucasians and African Americans, that's about a 1.3-fold disparity between those two race groups. So again, we do see that disproportionate burden on our African American population in terms of this disease. We've kept it low here. I've seen numbers that have more striking differences, but any difference is significant, and this is a significant difference. And it is something to continue to keep our eyes on, the fact that we continue to have many, many diseases that disproportionately impact our African American and people of color. And then basically the burden of those diseases lie with that population to a larger extent. Our cases are 74.3% not Hispanic or Latino, and 8.1% Hispanic or Latino, 17.6% unknown. So that's a 3,024 to 3,867 difference. That's once again right there in the 1.25, 1.3 fold difference between those. So we do see that disproportionate impact again between our non-Latino population and our Latino population as well. If we start looking at our deaths by age, we do have 2% of our deaths less than the age of 40. Those are the two individuals in their 20s that I mentioned before. We have 1.3% of these 153 deaths in the 40 to 49 age group. There are 6.5% 50 to 59, 13.1% 60 to 69, 34% 70 to 79, and 43.1% over 80. So that is basically 77% of our deaths are over the 70 or over. When we look at our deaths by sex, we see a little difference than we do with our cases. So we have 55.6% that are male, 44.4% are female. When we look at those deaths by race, African Americans are 18.3%, Caucasians 73.9%, Asians at 1.3%. We've kind of discussed the other categories there. So in our Hispanic and Latino population, 87.6% not Hispanic or Latino, and 5.9% Hispanic or Latino. When we look at deaths by zip code, 32 of our deaths are in 48823. 28 are in 48911. 48823 does have a slightly higher population than 48911. And then we go to 48854, which has 15, 48910 at 13, and the rest drop down from there. When we look at our death rate per 100,000 population, we still see that disparity or that disproportionate burden with our African American population, where that rate comes out to 64.4 for African Americans and 48.6 for Caucasians. That is a 1.2 fold difference. Deaths by month. So you can see that clearly deaths started picking up to some extent in August and September after low months in June and July. And then certainly in October, we really saw a spike in deaths, highest number of deaths we'd seen since the pandemic in the month of October, following a large surge in cases in September and into most of the month of September. And then now 47 deaths in the month of November, and at the 15th now of December, we so far have had 33 deaths in the month of December. When we look at that by week and show them to you by week, we did have a week where we had 18 deaths. I think I just did a average on those three. We're now up to about 14. I think it's 14 deaths a week. I think it might have been 14 and a quarter deaths per week if you calculate the last 4 weeks. I don't count the week that we're in because it's not over yet. So I go back to the last 3 weeks. We do occasionally see a death get added to previous weeks because the state does vital records surveillance, and every now and then they will find a death certificate that didn't get recorded or put into MDSS and has not been in the death records. And so then they notify us of that via a vital records analysis. Oh, and that is the end.
Thank you, Linda. Does anyone have a question for Health Officer Linda Vail? Go ahead, Scott Pohl.
Hi, Linda. First of all, you do sound a lot better this week. Thanks.
Thank you.
To my untrained eye, these numbers seem to have leveled off. And to me, that would appear to be encouraging, since Thanksgiving was almost 3 weeks ago now, that we may have expected a spike by now. That doesn't appear to have been the case. Do you see it that way?
Yes, in many ways I do. That we didn't see a significant spike after Thanksgiving. I think the only thing we have to take into account is that people traveled, especially our student population who may not be back. And so there might be cases related to that just didn't get recorded here because of somebody getting sick and being a resident somewhere else. Now, obviously, that's not the majority of our population. Majority of our residents are here, probably traveled for Thanksgiving, probably have come home. So really, you know, when we just look at our student population. So no, we really aren't seeing a significant uptick in cases in kind of the post-Thanksgiving holiday thing. So.
Does that give you any optimism about the Christmas and New Year's season, that maybe the message is getting through, that people shouldn't travel, that they should wear masks if they are indoors with people?
Well, yes and no. So yes, for the people who were like, you know what, I'm not traveling. I'm not doing this. I'm not going. I'm not going to, you know, excuse me, I'm going to follow the rules. They're going to say that worked, so I'm going to do it again. For the people who disregarded all the rules and said, I'm traveling anyway, I'm having my gathering anyway, they're going to say, see, that wasn't a problem after all. So we're going to do it again. That would be my guess. You know, we had people do both things. If people see that basically there wasn't a, you know, huge uptick or a significant problem in cases as a result, they're basically going to say, one, I was one of the people who did all of the things that I should have done, and so that was right, and that's what helped. And the others are very potentially going to go, excuse me, you know, it didn't matter after all, so I'm going to proceed ahead with Thanksgiving and New Year's just like I did the Thanksgiving holiday.
Thank you.
Dave Ackerley, go ahead, please.
Linda, with all the attention still that long-term care centers have gotten with COVID-19, of the 153 deceased in Ingham County, do you know how many of those are people who came from long-term care, from nursing homes?
You know what? I had that number a while back. Back when I just haven't dug into the data and done all of that again. Last I looked, it was about 45% of our deaths are from long-term care facilities.
And any idea of how many of the recent cases, when there was the upsurge and then, you know, the deaths come later? I mean, we're seeing cases go down, but the deaths are still there, that latent kind of trailing figure. Any idea how many, what percentages of the recent cases, say in the last month or two? Any idea?
That were in long-term care facilities?
Right.
Relatively few.
Okay.
Compared to I mean, when you're getting 1,000 cases a week, the number of cases in that relatively 1,000 that were in long-term care facilities is a relatively small number,
Okay.
Probably less than 10% compared to the total cases. I don't have the exact numbers. I've got an outbreak list somewhere. And like I said, I was tracking all of the different demographics around death, but I let somebody else start tracking that, and they started coming in so fast, and I just haven't had a chance to do a good data analysis of that yet. You know, I've checked it enough over the last several months that 45% seems to be kind of holding fairly steady. I think we did get close. No, I don't know that we ever got close to 50%, but definitely 45%. That's not far from 50%. So.
Oh, so it's a significant number of our deaths, but it's a much, much smaller number of our total cases.
Correct.
Okay. All right. Thank you.
Correct.
Thanks.
Thank you. Next, we have Robin Erb. Go ahead, Robin.
Thanks. Scott stole my question, of course, but
Who
to
stole
build
it?
on Scott,
Oh.
you know, and I wanted to ask the same thing about, you know, this plateau of numbers and it's the data, you know, I certainly want to be careful. This isn't, you know, hey, this is over, but there certainly has been this hopeful plateauing of a lot of numbers recently, whether it's hospitalizations or the cases, whatnot. But I guess my question is, could there be anything else at play other than, hey, people did things right for Thanksgiving, we didn't see that Thanksgiving surge? I don't know what it would be, but people keep saying, well, maybe people just stayed home at Thanksgiving. I just wonder if there's something else at play.
That's a good guess, or a good question, and is a guess. I mean, you know, with this virus, there's always something else at play. It's almost always something else at play. It's just a matter of figuring out what it is, you know? So, you know, there are any number of factors that are going on that, you know, it's just hard to say. You know, and I did read an article, and I wish I could find it because I'm not going to be able to tell you what the gist of it was, but I did read an article that said, you know, the plateauing of hospitalization cases is not as good a news as you think it is. Now, I have to find that article, so you might want to Google it, but I did see it, and I thought, well, that's an interesting title. I should read that article and find out what they're talking about. But I did see that kind of headline not long ago, and I wondered, now, what in the world does that mean? So.
Just to, I mean, I have no idea, but maybe I'm thinking along the lines of maybe it's people aren't in the hospital as long as they used to be 6 months ago because we figured out how to treat them faster. I don't know. I just brainstorming out other reasons behind the numbers.
Right.
Thank you.
Mm-hmm.
We'll go back to Scott Pohl now.
Hi, Linda. The Ingham County Health Department is launching an effort to get the word out about flu vaccines too. And I just wanted you to maybe expand on that a little bit. And while you're at it, maybe touch on running two kind of informational campaigns at the same time, where you're trying to keep the word out there about prevention related to COVID along with the flu at the same time.
Well, Amanda could talk to you better about the communication challenges than I could. You know, it's the usual. I mean, we have to keep up the usual. So the usual is you need your flu shot. The usual is, you know, December comes along, January comes along. It's still not too late to get your flu shot if you haven't gotten your flu shot. On top of it this year is we can't give you a flu shot and a COVID shot at the same time. So please get your flu shot in time so that when we're ready to give you a COVID shot, that is not a reason that we cannot give you a COVID shot, right? So those can't be given at the same time. As a matter of fact, they want you to wait a week or two from any other vaccination. So if you're getting ready to get your shingles vaccine or anything like that, you know, think about those things. So I was on a call with the CDC both Saturday and Sunday, you know, hearing some of those details about, you know, some of those contraindications and things for people to be concerned about. I will say, and I'm going off track, but yes, communication around flu vaccine is going to kind of wind down. We hope we've gotten to most people who know they need to get their flu vaccine. Usually by January, rather than a concerted communication efforts, it's more of that reminder that it's not too late. If you haven't had the flu yet, it's not too late. But I think we're going to have to shift most of our efforts really largely to the COVID vaccine and information about COVID vaccine.
Thanks again.
Mm-hmm.
Thank you. Yes, the vaccine for COVID is being received by the health department this week, and it will be several weeks or months before we're able to vaccinate the general public for COVID-19. In the meantime, we're suggesting that those who haven't been vaccinated for the flu do get that vaccine. So my little aside there.
Thanks.
Next up, I believe we have Rachel Sweet.
Hello.
Hi, Rachel.
A quick question about the East Lansing mask mandate. Do you think they should extend their indoor/outdoor mask mandate? And do you think that mandate will be effective?
Well, first of all, East Lansing does not have to extend an indoor mask mandate because there is a statewide mask mandate. So the outdoor mask mandate, you know, it really is up to them. I mean, you know, most of the places that I'm outdoors, you know, it's like, you know, as long as I'm 6 feet away from people and not in crowded settings, you don't need a mask. Incidental contact with people is not something you need to wear a mask over. So if I'm walking down a sidewalk and I pass 2 or 3 people, I've passed them for a few seconds, I'm moving on, that's incidental contact. If I was to stop and talk to those people, then we should be wearing masks. So the outdoor mask mandate in the city of East Lansing, I think, is largely driven just by the nature of the way people gather and hang around outdoors in East Lansing in their business district, as well as other places. So, you go to Ann Plaza and you got lots of people hanging out there. So there are a number of places where, people do just kind of hang out. And I think that's why they put that mask mandate in place. So to me, I would be looking towards, how much is that really a factor or a trend? And so how much benefit are you getting out of it as a result of, what exactly is going on? And Emily Elliott's right here, so she's probably about to tell me. So.
And then also in Clinton County, there's one bowling alley that is in a lawsuit right now because they refused to shut down. Can you kind of talk to enforcement rules in Ingham County? If the sheriff department is helping, can you talk to that?
We have lots of help in Ingham County. So Lansing Police Department helps us. East Lansing Police Department helps us. The Sheriff's Department helps us. I've gotten help from the Lansing Township Police Department. I've gotten help from the Meridian Township Police Department. So we do our best. I don't know how somebody with all of those people working with you manages to even continue to just defy it and stay open. The Liquor Commission, I believe, has already brought their license up for consideration or taken. They're in trouble with the Liquor Commission. They are also a facility that serves food. It's not that hard to take away their food license. There are a number of things that you can do that is going to make that a difficult business to have. And with the appropriate processes, you can go to the court for an injunction to get them to shut down.
Right.
We just haven't had to go that far here. I mean, generally we get cooperation. Every now and then we get a little bit of resistance. We've gone into bars and restaurants that were open, that were supposed to be closed, and simply said, you can't do this. And they've cleared everybody out. And we've gone into bars and restaurants where people were like, heck no, we're not leaving and we're staying open. And, then we got law enforcement help and we got them closed down.
Good to hear. So on top of what is the punishments by the MDHHS, then you guys would also be in there, or before it gets to that point, you have the sheriff department and helping you guys, right?
Right. Let's keep in mind specifically with bars and restaurants, we inspect them, we license them. If we inspect them and find them out of compliance with things to a nature that's egregious enough for us, then we can suspend their license. We can revoke a license. We can bring them in for a hearing to talk about their lack of compliance issues and keep them closed while we're waiting for that hearing. They're bars and restaurants. We can do that. We license them. So to me, to be able to go into a bar and restaurant that's out of compliance, because we did incorporate all of the MIOSHA COVID rules as well as the epidemic order rules right into our restaurant inspection. We check to make sure they are compliant. It's not like, here's our old inspection list. The trap, there's a distance between the sink trap and the sink drain that has to be a certain distance. Can you tell I went on a ride along with some inspectors? There's all kinds of things that they check in restaurants, and we now check these as well. We check for the signage, we check for the table spacing, we check for the adherence to staff wearing masks. We are there during the day when they're serving, and we check to make sure that they're managing their crowds well. And one of the other things that we have done is basically spend one night every weekend, basically boots on the ground. And that usually is in bars and restaurants in the area that tend to be the ones that get a little bit more rowdy, I should say, or something like that. after say 9 or 10 o'clock at night, not your normal 6 o'clock calm dining crowd, but 9 or 10 o'clock at night, and that, you know, the activities that tend to go on there. So we know who those bars and restaurants are, where, you know, and you probably do too. And we do regular checks of them every weekend.
Thank you.
Next, we have Emily Joan Elliott. Go ahead.
Thank you. I know vaccines have come up already, but I was wondering if you could elaborate if Ingham County Health Department would be receiving any in this kind of first wave, and what the hierarchy of distribution might look like.
So actually, we may very well have received vaccine today. It was anticipated to be shipped out and arrived at some limited number of places yesterday, and then another several hundred today. We would be one of those that are on the list to get that. And then the third day, from what I heard from the CDC, was distribution to places that did not necessarily have the cold storage, but they were, I don't know what that was part of in terms of the rest of that. But as far as the priorities, let me show you, hang on just a minute. Here we go. So in our first round of vaccination, so we had a priority 1A. So priority 1A was paid and unpaid persons serving in healthcare settings with direct contact or exposures. Yeah, anyway. And also part of 1A was long-term care facilities. So they took priority 1A and they set it up in 3 tiers. So first it's EMS, our hospitals, particularly the general medical floor, the emergency department, and the ICU. So you can see we're not just vaccinating everybody at the hospital all at one time. And then skilled nursing facilities. If you go to the tier 2, it's state psychiatric hospitals, home for the aged, adult foster care centers, and home health workers. And then if you go into tier 3, we have some additional workers with direct patient conduct who conduct high contact, high risk procedures, particularly when we're talking about generating aerosols. So dentists in people's mouths, GI docs who are going to put, you know, I had an endoscopy, they've got to go down your throat. It's an aerosol generating procedure. Other workers who have direct patient contact, including outpatient urgent care and ambulatory care. And then workers who have indirect contact with specialized skills that are critical to the functioning of the system, laboratory, pharmacy, et cetera. So that is priority 1A.
Can I ask a follow-up question then? So my understanding is that Sparrow and McLaren would be receiving and maybe then vaccinating some of the people on that list. Who would the vaccines that Ingham County is receiving go to on those lists you provided?
We also have healthcare workers in our department. And I believe originally we thought that we were going to have Sparrow do EMS. They are kind of bogged down with their own staff. It looks like we might be vaccinating EMS. So right now we're trying to see where the gaps are because everybody got less vaccine than they were expecting.
Okay. Thank you.
Mm-hmm.
Next, we have Dave Ackerley.
Hi, Linda. I'd like to go back to influenza issue for just a moment. The State Bureau of Labs, the virology lab, is it fair to say that's kind of the data, the clearinghouse for the numbers on influenza? Is that accurate?
Influenza is a tricky one for numbers. So are you talking about exactly how many flu cases there are?
Well, the reason for asking is they're only showing statewide through December 5th. That was their latest graph that I'm looking at. 1 case in Southeast Michigan, and that was not for that week. It was for the week prior, I think the final week of November.
Right, and they're not showing cumulative numbers there. I don't think.
So what are they showing, and where do the statewide cumulative numbers show up?
the statewide cumulative numbers show up in a document called My Flu Focus.
Okay.
So here's the thing with flu, though, Dave. Flu is not a reportable disease. Okay. So we do flu by what we call surveillance. So we have an influenza sentinel surveillance system that helps us identify what's going on with basically flu activity. So pediatric cases of flu are reportable. In general, what happens during flu season is those sentinel providers are healthcare systems. In some cases, they are schools. And that's how we basically track when flu activity starts to go up and when it starts to peak. It's kind of a little informal in the sense that it is people saying, oh, there's the My Flu Focus link. Thank you, Amanda. Oops, that's not the right link. So we use that system as kind of a generalized tracking system that basically tells us what is our general trend. Have we peaked? Yes or not? Have we peaked early? Is it a bad season? Is it a good flu season? We do not count every single flu case in adults, pediatric cases. So, you probably had the flu sometimes you go to the doctor, they don't even run a flu test. So we don't have a way in our system that laboratorily confirms every single flu case in the country. That's why when you see the flu statistics on CDC, you see these ranges of numbers. That's an extrapolation based on the cases that we do know. It's based on the influenza surveillance or sentinel surveillance, which really is like, for example, in a school, we have a school reporting system. So the school will call us and they'll say, we had 5 kids call in sick with the flu today. So there you go. That's 5 cases of the flu within the sentinel surveillance system. And then everybody across the country is doing it. Now, the downfall of that, as you might guess, is everybody doesn't know what flu is. And somebody might have some sort of a GI illness and come in and say, my kid's got the flu. And so you mark that as the flu. Hopefully people ask a few questions. The reason it works is because that's the way we've always done it. And the important thing is that it provides us an accurate trend, not that it provides us exact accurate numbers of the number of cases going on right now.
Is it fair to say, though, based on your experience and looking at the national maps to date, which show even with those reporting guidelines being a lot less specific than we have with COVID, that we could be looking at right now, and historically low flu season?
We could be. Let me pull up the flu focus. So here's flu focus right now.
All right.
You see the entire country is basically at a fairly minimal level. You've got some places where they're starting to creep up a little bit. And then you see these numbers, we've had 8 in region, a number of reporters, excuse me. So here are your number of cases. This one is usually the graph that I look at the most, okay? So this little black dotted line right here is the 2021 season. And yes, but look at the 2016-17 season. So do we know yet or not? We don't really know yet. Look at the 2015-16 season, which sat there just as flat as we are right now, straight out until the second week in January, and then really was a fairly mild season. So just because we're not seeing, as you can see, 2018-19, 2017-18, and 2019-20, we're already starting to uptick a little bit by now, which is right here. But we have other seasons that we're not. And we could go back more flu seasons. We could find flu seasons that peaked in December and were practically nothing by later on. So it does tend to vary quite a bit. But this is the graph I look at the most.
Could the heavy mask wearing, though, be a determinant this year that wasn't there in those past years, obviously?
The what now? Oh, yeah, yeah, absolutely. So, but we aren't gonna, to me, we're not gonna know that until we get out here or here, where
Okay.
we've had past flu seasons that have stayed absolutely flat, right straight through the end of the year, into the first or second week of January, and then started to go up. So this flatness is less common. We do tend to see cases start to peak up, but it's not unheard of that we would be at this point in time in this year and still be fairly flat in terms of what we're seeing in flu cases.
Okay. Excellent. Thank you.
Mhm.
At this time, we have no other questions in the queue. If anyone has a question, please feel free to go ahead.
I have a question if no one else does.
Go ahead, Rachel.
So can you kind of talk to what you think about schools evaluating their reopening plans following Christmas break?
Well, I mean, that's what everybody's going to have to reevaluate plans. I think, we've seen East Lansing schools already have a by choice option where they're going to open up, but, only if the parents want that. We've got honestly challenging decisions to make around education in the midst of a pandemic. There are ways to go back to school safely. We've heard Dr. Fauci say we need to get kids back to school. I heard him say that on a Cuomo show not long ago. It is important and it's a priority, but we have to make sure that they have the ability to mitigate properly, that they, have proper control measures in order to stay safe. Of course, we're coming in with, vaccinations and some things like that that are going to help. But basically the decision has got to be weighed with, what's going on with students in a virtual learning environment. And, I've seen things where, A and B students are making C's and D's and things like that. Now, I don't know how common that kind of thing is, but I think, as educators, as school boards and as educators, they need to be looking at the complete picture in terms of trying to figure out what's the best steps to move forward. We don't make a recommendation. We talk to them about the data that exists, and then they are their decisions to make.
Okay, got it. Thank you. And then the last one, I know you did talk about the vaccination plans and how they're broken up into tiers. Do you know anything? Have you spoken to any of the local hospitals like Sparrow or McLaren kind of about what they're doing?
They also received allocations of vaccines, and they are per that tier 1A, number one, vaccinating in their healthcare workers, starting with basically general medical floor, emergency department, and ICU. So that's where they start.